So today we are going to discuss basics of palliative care in oncology. So it is not possible for me to cover the entire palliative care topic in oncology in one session. So I'll just brief the outlines about what we do in palliative care in per se in oncology, and what is the difference between palliative care and supportive care, what is hospice and what is palliative care, and what is the situation of palliative care in India, and how we are doing these services in our setup. So I'll just brief you with all these different things. So there are palliative care itself it looks simple term, but if you see the detail, so there are multiple aspects to palliative care. So you need to address patients' nutrition, you need to address patients' symptoms, you need to address patients' general condition, you need to address patients' disease status, the cancer status, and what treatment he is undergoing, and what treatment options he is left with, and what is his prognosis, and what is his family status, and what is his social status, what is his cultural status. So many things are there. Everything we have to take care, everything we have to look for when we are treating the patient in palliative care setting. So if you see the supportive care improves patient-reported outcomes in cancer patients, but supportive care is a little bit different from palliative care. Supportive care itself is part of palliative care, but not synonym to palliative care. So if you want to describe what supportive care comes when the patient doesn't have any treatment options. So it is the care in cancer patients to for the prevention and management of the adverse effects. So when the patient is in the last stages of his life, when there are no treatment options, so in at that time, we need to support the patients, and we need to treat his symptoms. We need to give the patient the best possible quality of life. That is called supportive care. So, but when it comes to palliative care, the main goals of palliative care are to anticipate, to prevent, and reduce the suffering of the patients, to support the best possible quality of life of the patients, family, and the caregivers. So if you see the definition, there are multiple definitions given for palliative care. So the main definitions that we take are from WHO and the NCC and the body that gives the guidelines to the cancer treatments. So if you see the NCC and this one, NCC and excuse me. If you see the definition from the WHO, just have to read it. This is the services designed to prevent and relieve suffering for patients and families facing life-threatening illness through early management of pain and other physical, psychological, and spiritual problems. So palliative care is not only important in cancer or oncology, it is also important in other chronic illness like diabetes, hypertension, and so many other areas. So the WHO definition is a generalized statement, but NCCN, if you see, it is more linked towards the oncology. So what is palliative care? Palliative care is evidence-based treatment, and palliative care is vigorous care of pain and symptoms throughout the illness. And palliative care is care that patients want at the same time as efforts to cure or prolong life. So many people think that palliative care means there are no treatment options and we do nothing, but it is not true. Even if the patient is taken for palliative care, we do give the patient the options for some form of cure. Like we give the palliative therapy to the patient, that includes palliative radiotherapy, that includes palliative chemotherapy, and that includes sometimes palliative surgery also. But palliative care is not giving up on a patient. It is not in place of curative or life prolonging care, and it is not the same as hospice. So what does ASCO recommends? The American Society of Clinical Oncology, what does it recommend? It recommends to start palliative therapy as early as possible. So if the patient is diagnosed in any stages, like the patient is diagnosed at stage 4 or advanced stage, then we should start the palliative care treatment at least within 8 weeks of the diagnosis of the treatment. And if the patient is progressed The patient progressed from early stage of the cancer to the advanced stage, then we should try to start the palliative care as early as possible. That's what ASCO recommends here. So the palliative care should facilitate patient autonomy, and it should facilitate the access to information, and it should and patient should have his choice to select the modalities of palliative care. And palliative care becomes the main focus of care when disease-directed life-prolonging therapies are no longer effective, appropriate, and desired. So here you can see, so if you start palliative care early in the disease course, then the quality of life will improve. You cannot we may not improve the survival of this patient, but if you see the quality of life, then the quality of life is definitely improving if we start the palliative care early in the course of the disease. So who can practice palliative care? Anyone can practice palliative care. I'm telling you, anyone can, any physician, any medical staff can practice palliative care in their own way of expertise.